The Canadian Nurses Association has announced a new membership model that their CEO is calling a historic and transformative change in nursing and health policy. Dr. Valerie Grdisa joined us for more on the specifics of the announcement.
So, CNA has been the Professional Nursing Association for Canada for 117 years, and during its evolution, it's had different membership models. And over the past decade, many of the provinces and territories have put in new legislation that decoupled or um, disconnected the associations from the regulatory bodies. So the regulatory bodies are accountable for, um, you know, sort of setting the competencies for an individual to enter a profession, ensuring a standardized licensure exam is set across the nation, and then continuing to monitor based on standards of practice if there's any disciplinary issues and ensuring that nurses are meeting the minimum practice standards to meet the needs of Canadians. So, with that decoupling, so having them broken apart over the last decade, what that resulted in is many of the jurisdictions you would automatically be a member in CNA if you were part of a regulatory body and like joint regulatory body and association. And with those changes, what we saw is many of the associations across the nation that were not pre-established, which included the Western provinces, and currently there's none in Atlantic Canada. The only province where they've had an association for decades is Ontario, with both the RPNs and the RNs through RNAO and We RPN. This resulted in us having to find a way to bring back the jurisdiction. So for Alberta, they had a pre-established corporate entity that they established a few years back called Alberta Association of Nurses, and they wanted to rejoin the National Association. So we are doing it as a new structure, like a corporate partnership. And then for Newfoundland and Labrador, they don't have an association. So this is a group of nursing leaders that have come together over the last 2 years that want to find a way to bring their provincial voices back to the national tables and federal tables. Many people would think that, decoupling was the right thing to do because you are taking the lobbying function away from the regulatory function. But at the end of the day, a professional association is solely focused on the public interests for Canadian nursing and nurses to better meet the needs of Canadians. So we promote anything within our publicly funded not-for-profit health system that ensures that we advance nursing excellence and provide the best possible outcomes for Canadians. So in a way, our voice got weakened, and we're bringing our voices back together to strengthen them together nationally.
Dr. Grdisa also outlined the benefits that the structural change will have for the industry.
Well, if we even think in a broader context around the value of Canada being unified, especially with the current geopolitical tensions and the impacts of the trade war, we are seeing it in the same way as a profession. We represent 500,000 Canadians. We are 1 in 57 voters. So when our voices are unified provincially and territorially to the federal tables, we can come together with unified solutions that ensure that Canadians are getting their best value for their tax-paying dollars, and that the nursing workforce is being fully optimized, and that we're focused on strategies that bend the cost curve and ensure that our money is being spent in the most fiscally responsible ways.